Hi, my name is Dr. Adam Davis. I'm a chiropractic neurologist, and I want to show you how to track down an area of neurologic dysfunction. Now, our patient here suffers from POTS, and she's had that for a few years and is currently under treatment for autonomic neurology, but they don't really know what to do with her. So I'm going to go through and see if we can find out where her area of dysfunction is. Now, as always, we wanted to start off by just testing to make sure the muscles turn on and shut off the way they should. So I'm going to pinch this side here and we'll see what happens. It should weaken the arm. Press in towards me. And it does. So we know that that side's good. So let's check this right side. Same thing, I'm just going to pinch the pec, press your arm across, hold tight, and it doesn't shut off. Okay, so drop this down. So one of the ways we can figure out if it's coming from the right or left side of the body is by stimulating the talus. So I'm just going to lift up the talus on this side. And this activates her whole right side to see if that's where the area dysfunction is coming from. So again, we're going to pinch, hold in. Okay, that doesn't change anything, so we know it's not coming from the right side of her body. So let's check the left side of her body. So same thing, that's going to activate her nervous system on the left side. We're going to pinch. Press in for me, and it weakens the way it should. So we know it's coming from the left side of her body. Now we can figure out if it's coming from the front or back of her body by her moving her eyes. Okay, so with your eyes, I'm gonna have you look back to the left. Keep your eyes there. This tells us it's coming from the back part of the body, so we're gonna see if this makes her neurology work right. So we're gonna pinch, hold your arm in, hold tight, and it weakens, so it does what it should, so we know it's coming from the back side of her body, okay? So we're going to figure out if it's coming maybe from her leg. So I'm just going to compress her whole leg. And we're going to pinch. Okay, press across for me. That does not weaken, so we know it's not coming from her leg. So we're going to check her arm. So we're just going to activate all the joints in her arm by just doing a little compression. And we'll see if that makes it work. Press across. And it does. Okay, so we know it's coming from her arm. With her eye movements, we know it's coming from the back part of her arm. So we can just rub different joints to see where it's coming from. So we can just rub the back part of her wrist, press across, nothing there, back part of her elbow, press across, nothing there, back part of her shoulder, press across. It's coming from the back part of her shoulder. Okay, there you go. Neurology always works. Okay, so I'm going to rub the back part of her shoulder. There should be an area that's sore that's causing this side of dysfunction. So as I dig in there, is that sore tender? Mm-hmm. All right, so we know that this is the area that's causing this problem. I'm sure we can fix it and then help her with her POTS by balancing her brain and get a lot farther with her health care. But that's why you come to us.